طيب قبل ما نبتدي افتكر بس يهود في السيناريو وبعدينك يعني بس تذكير ما اكتر من كده. يعني افتكر الحاجات دي اشتغلناها والمستوى ماشي بيتحسن. يعني ستيب باي ستيب، تايم باي تايم الناس بتتعلم ال الفلو بتاع الانترفيو ذاته. لكن as any interview generally everything is يعني في كيس specific وفي حاجة general. أي interview you start by introducing yourself. أنا my name is فلان الفلاني. My role today is to take a history from you and to see how can I help you. So بعدينك open ended questions. So what brings you in today؟ العيان بيديك حاجة، بعدينك أنت مثلا على حسب الحاجة اللي جايك فيها. مثلا عندنا أليس هنا she is مثلا الليلة هي يعني fear of open or public spaces. احنا بنتكلم عن social anxiety تقريبا. ف it's an anxiety symptom. هتكلم عن anxiety، هتكلم عن how is this impacting her. she's gonna tell her story. You're gonna be specific. بعدينك مثلا الليلة anxiety what situations, how it's impacting you, how it's impacting your life. هتشوف الليلة associated symptoms اللي أي syndromal anxiety. ما social anxiety، في generalized anxiety، في OCD، في بعد depression. هل في bipolar disorder ولا لا؟ هل في schizophrenic symptoms ولا لا؟ انت you go with the symptoms. If you go with a checklist انت you cover the questions. لكن you get the narrative of what is happening, what how this is impacting the patient. Risk assessment is always going to be there. Coping is always going to be there. أي substance abuse is always going to be there. بعدين it's a full assessment اللي هو past psychiatric history, past medical history, family history, social history. وبعدين كان mental status examination. لو في mental state examination إذا في زمن يعني بس you go over the major steps بتاعتهم. You ask انت already you're gathering information from the history. لكن مثلا إذا في حاجات معينة، إذا عايز تعرف cognitive testing في الآخر. بتسأل العيان على الانسايت اند جادجمنت دي في الحاجات في النهاية. الكيسز الأخيرة دي بقت تكون زي افتكر بيدينا زمن بتاع 15 to 20 minutes. دي enough to conduct a full eval. في حاجة احنا شفناها مثلا زي في الكيسز اللي فاتت. يا جماعة العيان بيتكلم ما قاطعه. يعني it's a bad يعني هناي interviewing skills. خليه يكمل كلامه وبعدينك مثلا اذا فتح الكلام استنوا عليه ويكمل كلامه. لانه شغل المقاطعه دي انا اي نو it comes from an anxiety stand انك انت عايز تكفر الكيس. الموضوع غريب لكن عيان يتكلم ما قاطعه. تاني حاجة it's a good habit ساعات انك to be with the patient on the same page. يلا مثلا بعد ما تاخذ ال history of presenting illness جزء كبير منه تعرف انه social anxiety. انت ممكن تقول له summarize. So انت you tell me انت you came to the clinic today عشان عندك كده كده has been going on for the last couple of months. It's been getting worse. You tried medication, it's not working. انت you have كده you have كده وبعدين you don't have كده you have كده. Am I correct؟ في حاجة عايز تضيفها؟ لا. دي كلها جود يعني تشيك ليستي يعني انترفيو سكيلز. الحاجه دي بتنفعكم هنا ده، بتنفعكم لقدام في الكارير بتاعكم. الدار يطلع الدار يطلع برا السودان، الدار يطلع الخليج. يعني this is exactly is going to help you. الدار يطلع في يوكي. عشان كده انا بس يعني للناس الشويه they're feeling uncomfortable مع البروسس it's definitely is gonna make you uncomfortable. You're learning something new ما متعودين عليه لكن you need it was going to benefit you. فزي ما بقول الموضوع ده رب ضارة نافعة. it exposes you لحاجات مثلا في السودان ما كان عندنا. ف this is يعني something يعني to start before we start the case. أنا ما أعرف دكتور عبد الغني عايز to add something قبل ما نبتدي.
آه شكرا ياسر، كفيت ووفيت. بتفق معك تماما، ودائما بنكرر this is not an assessment, it is not an exam, it is training. اصلا الزول لا يحصل له anxiety لا يخاف، اي زول ممكن يغلط وبعدين بيصلح. وزي ما قال ياسر definitely you are improving much better than before. شكرا ياسر and you can start up.
طيب Alice Grant, scenario information. Alice Grant is a 28-year-old accountant who has been working from home. She has presented with an increasing fear of open or public space, which has restricted her daily activities. She has been referred to you by her GP for further evaluation and possible psychological treatment. A task: conduct a psychiatric history, which gives me an idea ان الموضوع ده غالبا 15 to 20 minutes. ايمان تفضلي.
دكتور ياسر، الأليس تقريبا اشتغلناها المرة الماضية، اشتغل
برضو؟
منتصر.
اوكي.
أيوة اشتغل أليس، أيوة.
سكايلر.
شكرا. لا، سكايلر ما اشتغلنا.
طيب تمام. Skylar Gretton. Scenario: Skylar Gretton is a 22-year-old software engineer who has approached your clinic upon recommendation from her GP. She is particularly anxious about an upcoming office conference where she is expected to speak. Her GP sensed that reassurance alone wouldn't suffice, hence the referral to your clinic for further assessment. Take a detailed psychiatric history to arrive at a diagnosis. In addition, gather information about the possible underlying factors contributing to her symptoms in the form of risk assessment. وحاجة تانية ذاته إنه الموضوع ده it's not about reaching a diagnosis. It's about the approach. It's about gathering the information and يعني how to conduct an assessment. A diagnosis seems to be obvious just based on reading السيناريو ده من غير التفاصيل حتى يعني it seems everybody knows exactly what seems to be the diagnosis لكن the approach so don't jump into the conclusion. هنا حتدينا حبة information للبري ريدنج احتمال اختصر منها حاجات لو المكررة. Social phobia, also known as a social and anxiety disorder, is a prevalent condition affecting approximately 7 to 13 of the general population at some point of their lives. Its onset commonly occurs in adolescence or early adulthood. Both males and females can be affected, though studies often indicate slightly higher prevalence among females. Cognitive model for social phobia. Clark and Wells, 1995, proposed a cognitive model for understanding social phobia. According to this model, individuals with social phobia tend to hold distorted self-image and have heightened self-focused attention. They often anticipate social interaction with dread, fearing negative evaluation, which trigger a cycle of anxiety and avoidance behavior. These cognitive processes can maintain and exacerbate the symptoms of social phobia. ICD-11 diagnostic criteria. Under the ICD-11, social phobia is classified as a disorder under an anxiety or fear-related disorder. The primary criteria involves a marked and excessive fear or an anxiety triggered by one or more social situations, as opposed to general, where the individual is exposed to scrutiny by others. The person often fears being negatively evaluated and avoids or endures with extreme distress these social situations. The symptoms should last for at least several months for a diagnosis to be considered. NICE guidelines for social phobia management. The National Institute for Health and Care Excellence, NICE, recommends step care model for treating social phobia. Step 1, identification and assessment. Step 2, for less severe social phobia, individual guided self-help based on the principle of cognitive behavioral therapy is often the first line treatment. في زول فاتح ميكروفونه.
لا لا
طيب قفلناها. For moderate 3, step 3, for moderate to severe cases, individual CBT tailored explicitly for social phobia recommendation. Step 4, consideration of pharmacotherapy, usually SSRIs, is reserved for severe cases or those who do not respond to CBT. The management of social phobia shares similarities with treatment approach for panic disorder, although beta blockers are employed to diminish autonomic symptoms. These medications are particularly effective in lessening performance-related anxiety. Medications should be used as the sole management strategy. Should not be used as a sole management strategy. Step 5, for cases that do not respond to initial intervention, more intensive treatment like combination therapies or residential treatment programs may be considered, which يعني دي أنا بالنسبة لي very questionable. Residentially. NICE strongly recommends involving the patient in decision-making process, discussing treatment options and obtaining informed consent before initiating any form of treatment approach. Understand that Mr. Oliver Green may be challenging to engage. انتوا كان اسمه Oliver Green؟ أو مشكلة Oliver Green or Oliver Green. May be challenging to engage initially. He might be highly anxious about the medical appointment due to ongoing symptoms and imminent life events. If open-ended questions aren't effective, candidates should switch to closed-ended questions to identify the core symptoms. Hi, I'm Dr. Taylor, part of the psychiatric treatment here. Your general practitioner sent you to us for an anxiety issues. Could you elaborate? اللي هي بس introduction وبعدين open-ended question. الحاجة دايما الليلة لما يجيك مثلا زول who are not talking because extremely anxious, you should show some empathy and you try to do some reassurance at the beginning. يعني ممكن an example هنا, I see you're anxious, but I want to tell you that many people with such conditions like yours come here very often, and we're happy to help them with their symptoms. And we're here to help. يعني this في الآخر reassurance and open, يعني reassurance and validation في الأول. لو مثلا بيجوا صعب. لو بيجي بعدين مثلا they're not open, like responding to open-ended question, you have to go with the direct question. History and core anxiety symptoms. For how long have you been experiencing these issues? Could you describe specific situations where you experienced these feelings? Could you go into detail about the symptoms you encounter in these situations? Blushing, dryness of mouth, palpitation, shaking, urgency, fear of micturition or defecation. How do you respond when you feel this way? Psychosocial impact of an anxiety symptoms. Are there specific scenarios you find yourself steering clear of? Are these symptoms interfering with your work life? Is this affecting your personal relationship in any way? Rule out comorbidities because they're common. Do you often find yourself fretting over minor daily matters? Have you experienced panic attacks? Is it challenging for you to leave your home? Are there particular things that trigger your fear? Do you suffer from nightmares or flashbacks? Personal history and etiology. Have you consulted with a psychiatrist before? Is there a history of mental health conditions in your family? Could you talk about your childhood? Were there any particular challenges? Do you suffer from a chronic medical conditions? And if so, are you taking any medications? Am I correct in understanding that because of your current symptoms, you have been avoiding certain situations and options for work that does not need much social interaction? Have you felt the need to use any alcohol or recreational substances to help with the current feelings? Key points. Make sure you build a rapport with the patient, especially since he might be overtly anxious. Use empathy and active listening to help to put the patient at ease. Adapt questioning styles. Be alert to the patient responsiveness and switch to close-ended questions if he's not forthcoming with open-ended ones. Comprehensive assessment. Ensure that you thoroughly cover the range and depth of diagnostic criteria. Do not forget to rule out potential anxiety disorders and assess patients' overall mood. Identify underlying factors. Make it a point to inquire into a document and and document the etiologies involved. This should include perpetuating and protective factors relevant to the patient's condition. طيب ألا جاهزة؟
Yes.
طيب أنا حتجاوز دي.
Hi there. I'm pretty nervous being here.
Hello. My name is Dr. Ala.
Hi.
Hi. My name is Dr. Ala. I'm a resident in psychiatry, and I'm here to help you, so you don't have to worry about anything. I'm here to do my best in order to help you with whatever brought you here today with us.
All right. Thanks, I guess. I'm
So,
still a bit anxious, but I'll try to answer your questions.
thank you so much. Okay, can you please start? But I want to confirm your name. So your name is Skylar Gritton. Is that correct?
Actually, it's Skylar Gretton, not Britton.
Grattan. Okay, thank you so much for correcting me. What about your age? How old are you?
I'm 22.
Okay, nice to meet you, Skylar. So first, I would like to confirm that you were sent by your GP. Apparently, he's worried about you having some anxiety. Is that correct?
Yeah, that's right. My GP thought talking to someone might help, since I've been struggling with anxiety, especially lately.
Okay, so now I'm just going to explain what I'm going to do. I'm going to take medical history from you, and I'm going to ask you some questions Some are going to be a bit difficult, but I'm sure you can answer them all, so you don't have to worry. Is that okay with you?
Yeah, that's okay. I'll try my best. Just a bit
Okay,
nervous
thank you
about
so much.
personal questions, but I get why you need to
It's
ask.
okay. It's okay. I'm gonna make sure that you're not uncomfortable in any way. And if at any point you feel overwhelmed, you can tell me.
All right, thanks. I appreciate that. If I need a break or anything, I'll let you know.
Thank you. So
You're welcome.
I'm going to start by asking you, what caused this fear or anxiety, or what brought you here today?
It's mainly because of an upcoming conference at work. I have to speak in
Okay.
front of everyone, and just thinking about it makes me feel panicky. My anxiety's gotten worse since I found out about it.
Mm. Since when you have been feeling anxious?
It's been going on for a while, honestly. I noticed it more in my mid-teens, but it's gotten a lot worse recently because of work stuff. The public speaking part just makes everything more intense.
Only the public speaking part? Can you deal in your social life? Can you communicate without getting fearful or panicky?
I can handle small groups or one-on-one conversations, okay? Especially if it's about work or something I know. But if I'm the center of attention, like in meetings or bigger groups, I get really anxious. Public speaking is the worst. It just feels overwhelming.
Have you been put in this situation before where you were forced to publicly speak?
Yeah, a few times at university and once at my old job. Every time. I felt sick and shaky, like I couldn't breathe properly. I usually try to avoid it if I could, but sometimes I couldn't get out of it. It was always really hard.
Mhm. Can you elaborate on what you feel, the physical symptoms, the psychological symptoms that you go through when you have to speak publicly?
When I know I have to speak, my heart starts racing and my hands get really sweaty, like I feel shaky. Sometimes I tremble so much I worry people will notice. My mind sort of blanks out and I can't get my words out properly. I feel like everyone's judging me or waiting for me to mess up. It's like my body reacts before I can even process what's happening. Sometimes I get so panicked, I just want to run away.
Did you ever go through a panic attack in one of those meetings?
Yeah, I think so. There have been times before a talk where I felt like I couldn't breathe, my chest was tight, and I thought I might faint.
Skylar?
I had to leave the room once because it got so bad. It felt like a panic attack. Are you still there? Are you still there? Are you still there?
عندها مشكلة في الشبكة ظاهر ولا شنو؟ لا عندها مشكلة.
شكله احتمال.
Sorry, I don't quite understand what you mean. Could you repeat that?
طمنها يا ياسر، قول لها جاياك بعد شويه. قول لها جاياك بعد شويه، ما تنزعجي.
Yes, the doctor had to leave for an emergency. She's going to be back in a second. I'm sorry for this interruption.
That's all right. I understand. I'll just wait here until you're back.
Thank you.
No problem.
الشبكه في السودان مشكله حقيقيه والله.
كان ماشي كويس في الأول. في زول باك اب. مستعد انه لو في زول باك اب هنعيد الكيس تاني من الاول. هنديها
او
5
ممكن نبتدي
دقائق.
مع الكاس دي
السلام
من الاول
عليكم
يا
يا
ياسر.
بوس.
I'll stay. Just let me know when we can continue.
ممكن نبتدي معاها مع نفس البيشنت دي من الاول.
ممكن.
All right.
يلا يا شباب، خلاص وقفها يا ياسر وابتدي من الاول. يلا واحد من الشباب ياخذ الكيس.
السلام عليكم، أنا
Sorry.
النجومي صالح، الدفعة 50. ممكن
عليكم
نشتغل إن
السلام
شاء
ورحمه
الله.
الله. اوكي.
دقيقة النجومي. عليكم السلام، بس ثواني انا ما اعرف دقيقة.
Hello.
يا لا.
Hi. Hi. I'm so sorry. My network is terrible.
لا لا، عادي عادي، هنعيد الكيس من الاول تاني. ثواني بس دقيقة. طيب الان اديك فرصة ثانية، لكن يعني بس خلينا عشان نكون يعني براكتيكال. النجومي النجومي قاعد.
أيوة يا بوس، معاك.
خليك
موجود.
باك اب لو لا قطعت في اي حاله من في زي نفس الكيس قبل شويه انقطعت. يعني بس تيك اوفر، قول لها معلش احنا ماي كوليك هاد تو ستيب اوت، وبعدين تيك اوفر. خلاص، لكن بس
تمام
هدي
إن شاء
فرصه
الله
ثانيه
بإذن
نبتدي من
الله.
الاول. الا
It's
Okay.
okay. It's
Yes.
okay.
هنبتدي من الاول ثاني. الا حتى تعمل الكيس النجوم يخليك باك اب اذا الموضوع حصل اي لخبطه ثانيه ولا اي حاجه. الا لو طلعتي مره ثانيه بس النجوم هيز جونا تيك اوفر، ما ترجعي ثاني تستلمي الكيس. كويس.
حاضر. Understood. حاضر.
تمام إن شاء الله.
دقيقه دي ثواني، هرجع ثاني بس ثواني. لا جاهزة؟
Yes.
اوكي تفضلي.
ما ظاهر لي شيء في الشاشة.
Hi there. I'm pretty nervous being
Hello.
here.
Hello. You don't have to be nervous. I'm here to help you.
Thanks. I know you're trying to help, but it's hard to just switch off the nerves. This whole thing feels pretty intense for me.
It's okay. This is a free of judgment zone, so you don't have to worry about anything. I'm here to help you. Let me introduce myself. I'm Dr. Ala Abdelhadi. I'm a resident in psychiatry. I just want to confirm your name. Your name is Skylar Glidden, right?
It's Skylar Gredden, actually. Thanks for clarifying.
Thank you for correcting me.
I appreciate
How old are
you
you?
saying
Oh,
this is a
thank you.
judgment-free zone. I still
Thank
find
you.
it hard to relax, though.
Yeah, you don't have to worry about anything. As I told you, this is a judgment-free zone. I'm just here to listen and do my best in order to help you.
Thanks. I'll try my best to talk about it, but it's still pretty overwhelming for me right now.
It's okay. It's okay. You can take your time. Whenever you feel nervous or overwhelmed, you can tell me and take a break. We can take a break at any moment you want.
All right, thanks for saying that. I'll try to let you know if it gets too much. Just talking about my anxiety makes me a bit on edge, but I'll do my best. Are you still there?
Okay, Skylar. My colleague had to be called in an emergency, okay? I will continue with you. My name is Dr. Niyume. Your psychiatrist also, okay? Can I continue with you? Is that comfortable with you?
Yeah, that's fine. I just need a bit of consistency. So as long as you let me know what's happening, I can manage. Let's just try to keep things focused, please.
Okay, listen to me. She started about asking you about your name, okay? Your name is Skylar Grettin, you know, and you came here, referred from GB to our psychiatric clinic here.
Yeah, my name is Skylar. I came here because my GP thought I needed more than just reassurance.
Again,
It's
I'm
mainly
Dr.
about my
Aniyumi,
anxiety, especially
as
with the
my colleague.
conference coming
Okay,
up at
Dr. Ala.
work.
Okay, you complain of anxiety. For how long you complain of that symptom? You complain of anxiety. For how long? Please.
I felt this kind of anxiety since my mid-teens, so for several years now. It's always been worse with things like public speaking or being the center of attention.
Mm. Mhm. Okay, it's increasing with social interaction, interfering with your colleagues in a office or in a work, as I think. Is that right?
Yeah, that's right. It gets much worse when I have to speak up in meetings or if there's any attention on me at work. Just being around big groups makes me anxious, but public speaking is the worst.
Mm-hmm. I see. Okay, Skylar. When is the last time you experiencing anxiety?
Honestly, just thinking about the upcoming conference makes me anxious right now. But the last really bad episode was at a team meeting last week. I had to speak about a project update, and my heart was racing. I was sweating, and I just wanted to disappear.
Okay, Skylar. Could you explain to me that experience, that episode in details, please?
Sure. So during the team meeting, when it was my turn to speak, I felt my heart pounding really fast. My hands were shaking and I could feel myself sweating. My mind went blank for a second and it felt like everyone was staring at me, judging every word. I stumbled over my words and all I could think about was getting it over with as quickly as possible. Afterward, I just wanted to hide.
Mm-hmm. Okay. And that episodes is this that episodes affected your sleep pattern or something like that, or
My sleep
interaction
gets worse when
socially
I'm
with your.
anxious about something coming up, like the conference. I have trouble falling asleep and sometimes wake up early thinking about what could go wrong. Otherwise, it's usually okay.
Mm-hmm. Okay. And that episode of panic that you say, did you feel any palpitation or increase in your heart rate or breathing faster? Did you feel any abdominal cramps or did you feel any uncomfortable mood or something like this?
Yeah, I definitely feel my heart pounding and going really fast. I get shaky, sweaty, and sometimes it feels harder to breathe, almost like I'm choking. I also just want to leave the room or hide. It's really uncomfortable.
Okay, I'm sorry. I'm sorry, Skylar. You're experiencing a lot of things, bad, terrible things. And we are here to help you I appreciate it.
Thank you. I just
Um,
want to find a way to
let,
get it through the conference without completely panicking. It's been exhausting dealing with this on my own.
okay, as I see, you said you experiencing the last week the episode of panic attack. It was terrible, and that affected your sleep, affected your function and social interaction with your peers, your family, and other partners. Okay, let me ask you more further about your social interaction with the family dynamics
All
and
right.
the other siblings. Did you married? Are you married? Please.
I'm not married, but I have a long-term partner. My family lives nearby and I see them sometimes. I'm close with my younger brother. I keep social things small, mostly just a few people at a time. Big gatherings are really stressful for me.
Excuse me. What is the makes you stressful again?
Sorry, could you repeat that? I'm not sure I understood your question.
I'm asking you, Skylar. Did you feel stressful in the recent days with your family? Okay, explain that more further to me, please.
Yeah, I get stressed even with family, if there's a big event, or if I have to talk in front of everyone. But with just my parents and brother, it's not as bad. I still worry about saying the wrong thing or being judged, even with them sometimes.
Okay. Uh, have you ever experiencing detachment of the reality, or you detach from your personality, or something like that?
Sometimes when I'm really anxious, I feel a bit disconnected or like I'm not fully present. It's not all the time. But during really bad episodes, it's like things get fuzzy. I don't feel like a different person though, just kind of out of it.
And what did you, Skylar, when you have such episode like that? What did you do?
When I feel that way, I usually try to focus on my breathing or step outside for some air. Sometimes I just try to distract myself, like listening to music or fiddling with my phone until it passes. Mostly, I just try to get through it quietly.
And that's working? That's working with you?
It helps a little, but not, it
I
helps
see.
a little
Okay.
bit, but not enough. The anxiety always comes back, especially before big events. I don't feel like I have any real control over it.
Okay. Did you take any medications or illicit drugs or alcohol or something like that to improve your mood, to improve and avoid anxiety?
No, I've never taken any medications for this. I don't use any drugs or alcohol to cope either. I mostly just try to avoid the situations or get through them as best I can.
Okay, that's right. And have you ever seen a doctor, psychiatrist, or any specialist in this for this reason, for anxiety or treating from these episodes? Or
No, I haven't seen anyone before about this. This is my first time actually talking to a professional about it. My GP suggested I come here because reassurance wasn't really working anymore.
okay, Skylar. All right, I see you are anxious in the last days, and we are here to help you again. I said that, and we will prescribe some medications for you. You will put in some psychotherapy for you, and I will differentiate the different type of management to you in the last of our interview here. Okay, did you feel comfortable with me?
Yeah, I appreciate that. It's still a bit hard to talk, but I do want to find a way to manage this. As long as you keep me in the loop about what's happening, I'll try to stick with it.
I appreciate it, Skylar. Let me ask you further about the condition of anxiety.
Okay.
Does that affect your mood? Your mood. What about your mood? Is that you feel
Yeah.
low mood or high mood or what?
Sometimes my mood drops, especially when I'm dreading an upcoming event. I get frustrated with myself for not being able to handle things like other people seem to. But I wouldn't say I'm depressed all the time, just low when the anxiety is really bad.
I'm sorry to feel that. I'm sorry to feel that. And your family, did they help you in that way to decrease the anxiety, to decrease the stress and your low mood? Did they help you or your colleagues or your friends?
My partner tries to help, but they don't really understand how intense it feels for me. My parents want to help too, but they don't know what to do. It's mostly just me trying to get by on my own.
And are you believe on us we can help you? Inshallah, we can help you and give you medication and do psychotherapy and we make you improve better. Are you believe on that?
I really hope so. I want to believe things can get better, but it's hard for me to picture it right now. I'm willing to try what you suggest, though.
Okay, Skylar, I want you to focus and to be sure we will help you. Do not hesitate, and that makes us doing better with you. You are improving with us. You will improving with us with medication and psychotherapy. Okay. Do you have any questions?
I guess I just
Ask
want to know
me.
what to expect with medication and therapy. Like, how long does it take to notice any changes? And will I have to do public speaking before I feel better?
Okay, treatment will be run through 3 parts. Okay, it's a biopsychosocial approach, as I know. And we starting with give you medications that decrease the episodes that you experience in the last days and last few months. When that episodes decrease or improve, we start psychotherapy, and that will make you improving and decrease the episodes frequency, and we will improve through the days. Okay, it's not from the first day, from the
All
start.
right.
It's not a magic. Okay.
I figured as much. I know it won't just disappear overnight. I just hope I can get through the conference without it being a disaster.
Right, you understand that well. And do you have any further question? Can I explain to you?
Not right now. I just want to know what to do if the anxiety gets really bad before the conference. Should I reach out or just try to manage it myself?
And when did your the conference will be?
It's in
In which
about 2
time?
weeks. That's why everything feels so overwhelming right now. I keep thinking about it nonstop.
Okay, right now we will give you medications that limitate your episode and decrease its effect. Okay, like a heartbeat that's improving, that like a hyperventilation and abdominal cramps. And when you feel sad, we will give you medication for improving your mood also. And that's help you in the next 2 weeks. Although our medications in sometimes take for 2 to 4 weeks to start their effect. Okay. you will wait and to be patient with us, please. Okay?
Okay, I understand. I can try to be patient, even though I'm nervous about the timing with the conference coming up. I just don't want to completely freeze up in front of everyone.
Okay, thank you. Thank you. And lastly, I want to thank you. And that was a good interview with you. Did you feel comfortable again? And I'm asking you to continue your management with us, and we will be improving again, inshallah. Shukran.
Thank you. I felt as comfortable as I could, given how anxious I get talking about this stuff. I'm willing to keep going with the treatment plan. I really hope it helps.
And that helps. That we will be help you as soon as possible. We will do the effort of us to make you do your job again, okay? And make you social interactive again, okay? Don't be worried. All of us with you. You can come here to our clinic and every time you want, okay?
Thank you. I appreciate you saying that. I'll try to trust the process, even if it's hard. Just need a bit of time to adjust, that's all.
All right, Skylar, goodbye. And I see you later, soon as possible. All right? Now we will prescribe a medication for you.
All right. Thank you for your time. I'll see you soon.
Thank you, Ms. Skylar.
طيب افتكر هناي يعني ممكن نبتدي على انت how do you think يعني هناي البرفورمانس كان كيف؟ انا جومي.
والله يا بص I show the empathy. انا تقريبا اشتغلت انه احاول الناس الانزايتي والمود ديس اوردرز بيحبوا انه انت تسوي ذا empathy and sympathy وتكون شويه interactive معاهم، فحاولت بس اكون في الجانب ده.
sympathy ولا
ما
empathy؟
اعرف هل I run through the empathy. معلش يا بص.
اه
okay I show the empathy. okay
this is sympathy.
sympathy. معلش sorry. okay and انا افتكر انه الهيستوري I didn't run through the all items of history. okay
هو التاسك شنو بس عشان شويه لانه افتكر الحته هنا كلها what was the task انت given to you؟
The task is about her anxiety, reassuring her about her condition, anxiety, and the plan of
Yeah.
management, I think.
كده نرجع تاني للتاسك. فهمت؟ your task هنا في الاخر نشوف التاسك كان شنو. دقيقه افتكر لو مرقنا هنا من الاول.
Social anxiety, I think that's the diagnosis.
الدياجنوز كان التاسك في الاخر كان مطلوب منك شنو يعني؟ هذه التاسك هنا
Sorry.
take a detailed history and arrive at diagnosis.
Yes.
A task and also the task gather information about possible underlying factors contributing to her symptoms and form a risk assessment. The task, this is the task. ما عنده أي علاقة ب يعني provide reassurance ولا do يعني فهمتها؟ It's an assessment. It's history في الآخر التاسك.
Yes. أي. في الهيستوري I take a history presenting illness about her condition. I take a social history a little bit. I take a past psychiatric and drug history as I know. وتقريبا الفاميلي داينامكس ما اتكلمت عنها كتير، بس شفت السبورت بتاع الفاميلي وكده. كان نشوف الفرونسيك هيستوري وباقي الايتمز، مثلا سايكوسيكشوال هيستوري، بري موربيد بيرسوناليتي، كان مفترض اسال عن تشايلد هود معلش، على اساس انه دايما بيكون عندها امباكت بالذات في مشاكل الانكزايتي والبري موربيد بيرسوناليتي حق كده.
طيب انا افتكر انت you started by introducing yourself. نبتدي من الاول. You started by introducing yourself explaining exactly انه كان في
Yes.
interruption. هي بدات بآلاء، بعدين انت مثلا آلاء بدات في الاخر you had to jump in. You had to jump in وبعد شويه was يعني ان لما يحصل jump in ما that's not the ideal situation، لكن انت you did well. You jumped in, you introduced yourself, introduced your role وبعدين you started asking her about what brought her in here انه في الاخر تسأل عن anxiety symptoms هي what brought the patient in here. فدي it went well، ما في كلام. بعد شويه الموضوع is more about task for history. The task is history gathering. هنا شويه انت يعني بقيت تسألها مثلا عن الهيستوري، لكن في جزء منها بقى is focusing on reassurance. الريassurance to some extent is important هنا، لكن يعني بيجي في نوع من الريassurance انه are you comfortable with us؟ أما
معلش يا
يعني
ابو، صوتك قطع شويه، انا ما سمعتك، شبكتي بس شويه، معلش.
قلت لك انت بديت by introducing yourself, introducing your role, explaining exactly what is happening. في
انا
جزء
بس
منها
النقطه
الليلة،
الاخيره. ايوه،
في
الري
جزء من
اشورنس من النقطه اللي انا بديت اشتغل في الري اشورنس اكتر.
مما بقيت في الرياشورنس بقى الموضوع تقريبا هو السايكوثيرابي، لكن في السايكوثيرابي ذاته بقى نوع منه انه هو زي السيرفي بتاع how our services are you comfortable with us ولا لا. if you يعني you have to be comfortable with us عشان تستفيدي. ده ما عنده علاقة بالتاسك كله. التاسك was history obtaining. ففي الرياشورنس از مور اباوت يعني لما قالت لك انا my heart is pounding, I feel anxious, I feel like I cannot يعني هنا I breathe, I feel overwhelmed around people. This is exactly when you can jump in. You can tell her this sounds this sounds like a terrible experience, and it sounds like you're dealing with really hard time dealing with this anxiety. This is exactly into you're showing sympathy and you're showing somebody and understanding the symptoms. لكن beyond that الليلة you're comfortable with us, are we comfortable with you، بقى الموضوع شوية برا التاسك هنا. ده completely is more like a survey للكير ذاته. فهمت؟ ف you should not go into are
يس
you comfortable
بالضبط.
with us, am I comfortable with you. ده ما عنده علاقة بالكيس أساسا. The case should be focused on the history. الهيستوري. فهنا الكيس بتاعت الهيستوري انت دخلت في نص الكيس بقيت للمانجمنت تتكلم عن، او في المانجمنت بقيت تتكلم عن medications هنا. هو التاسك في التريتمنت is talking about psychotherapy, talking about basically يعني sometimes exposure techniques بعدين CBT. لكن they're not asking you exactly how are you going to manage this patient. هم لو في النص she asked you exactly how are you going to manage me ممكن تخش في الموضوع ده. لكن she was more focused on a task اللي هو الكونفرنس جاي وما عارفه تعمل فوقه شنو. فانت افتكر هنا شويه ديك حصل deviation للرول بتاعك هنا. فانت you have to ask about the
بالضبط.
presenting symptoms الليله an anxiety as a task what triggers these anxiety symptoms, any previous experience, how is this impacting her الsymptoms بتاعت الموضوع ده كيف how when did this started, what helps what does not help. فهمت؟ هسه بعد شوي انت you go and يعني rule out other generalized anxiety disorder, phobia, panic disorder. بعدين depression انت you want to ask if the patient is depressed ولا لا. If they're going through symptoms of depression يعني the sadness, lack of energy, lack of motivation, suicidal ideations. كل الحاجات دي you have to screen it لأنه it's common as a comorbid symptom. It's a very common thing. People يعني develop يعني هنا panic disorders وكان develop برضه معاها هناك معاها social anxiety. ف this is all you have to screen. You go بعدينك past psychiatric history, any hospitalization, any previous suicidal attempt, any previous medication trials, any دي كلها تسأل منها. بعدينك تسأل من medical history يعني health problems, current medications, if she's taking medication that is increasing her anxiety ولا لا, thyroid problems that can mimic such presentations. بعدين you go with the family history, any family history with similar conditions, any family history of mental illness, any family history of suicide. دي كلها تبع الهيستوري. يعني هي الكيس كانت هيستوري ما كيس بتاعت ري اشورنس ما كيس بتاع مانجمنت. في الاخر مانجمنت is completely off هنا completely الا لو سالتك في الاخر how are you going to help me انت this is exactly when you take over في الموضوع ده. لكن مانجمنت ما عندها علاقه بالري اشورنس. وحتى الري اشورنس is you don't ask about you don't ask the patient do you feel comfortable with me. انا لو عيان هنا ده بقول لك لا انا بعرفك من وين عشان تقول اكون comfortable with you ولا لا. I don't know you. I'm building, and you start to build trust, and trust is built throughout the process. And people might not trust you until a while, وده normal. فشوية دي ما كان عندها علاقة. لكن you go with the family history. You perform a full psychiatric evaluation. This is not about management. وفي المانجمنت الميديكيشن role comes at the end ما في أول حاجة.
هاي بالضبط كده يا بس، بالضبط كده.
شايف أستاذ دكتور عبد الغني إذا عايز يعقب وبعدين يعني ممكن أشوف الكلام في التفاصيل هنا.
شكرا النجومي، شكرا ياسر على الكومنتس. yes you are right. ربما النجومي ما بدأ من الأول، ما كان عارف التاسك، عشان كده هو الحقيقة دخل يعني غصبا عنه في ظروف بالغة التعقيد زي ما بيقولوا. لو كان ركز من البداية على التاسك أفتكر he could have done much better. لكن عموما it's okay. أنا بتفق مع دكتور ياسر، إحنا صح we don't need to reassure and reassure and reassure. It's a matter of 15 minutes we have reassured her more than 5-6 times يعني. ف الassurance والreassurance just one or maximum 2 times is quite sufficient. الحاجة الثانية ودي دائما نحن بنقع فيها كلنا، في مرة قلت لها إن شاء الله ومرة قلت لها شكرا بالعربي. طبعا دي حاجة متعودين عليها دائما
ايوه
في لغتنا
معلش،
صح.
عايز الالتزام بس، ايوه معلش.
ايوه فما مشكله، لكن نحاول نتحاشاها. حتى زمان وفي الامتحانات السابقه لما نجيب اكسترنال اكزامينرز من يو كي واكسترنال اكزامينر في الام دي بتاعتنا من افريكا، يعني انجلش سبيكينج. فالترينيز لانه متعودين دائما بيتكلموا بالعربي كثير حتى في البرزنتيشنز، فالكلام كان كثير بالعربي وهو هي واز astonished كده. كويس انه معانا كان دايما انترنال اكزامينر سوداني، ففهموا قال له بس هم مرات بيقولوا الكلام ده لانه بيشوفوا Arabic speaking patients. لكن عشان كده دايما نحن بنقول عشان نتدرب على الحكايه دي definitely لما when you interview patient سوداني بيتكلم باللهجه السودانيه اسهل كتير no doubt، لانه دي لغتنا وفاهمين الكالتشر كيف وفاهمين كل حاجه. انا دايما بقول للترينيز لما تقدموا حاله حتى في المستشفى مع السوبرفايزر حقك مع الترينر try to speak in English 100% do it. يعني بالبدايه صح هتطلع كلمات ان شاء الله وشكرا وما عارف ايه، لكن في النهايه بتختفي الكلمات دي لما نتدرب. لكن جنرالي شكرا لك وشكرا لعلاء برضو، بدت بدايه كويسه لكن الشبكه ما اسعفتها. ثانك يو.
يديكم العافيه يا
توفيق.
محمد، شكرا لك.
تسلم
يعطيك
النجومي.
العافيه.
يا شباب،
تفضل دكتور عبد الله.
السلام عليكم.
عليكم السلام دكتور عبد
السلام.
الله.
يمكن أنا ما عندي حاجة كثيرة أقولها. يمكن الدكتور كان ما كان prepared، عشان كده ما أحاط بكل الكلام المفروض يقوله. يعني هو التاسك اللي أدى له كان يعني it should have been better than this. لكن one point انتوا الاثنين اتكلمتوا فيها، حكاية are you comfortable and trying to pacify her and so such comments will make the patients, some patients, uncomfortable because they think that you are not confident in yourself and you are not sure of what you are doing. So people should be aware of that. شكرا. يعني البوينت اللي انا كنت I wanted to
شكرا دكتور عبد
emphasize.
الله، شكرا لك، شكرا لك.
نعم.
طيب شكرا دكتور عبد الله.
شكرا لكم يا ابو صاد.
شكرا لك. منو تاني عشان نمسك في الكيس اللي بعدها؟ دقيقة احنا نطلع مع الكيس ذاته. منو معنا في الثانية؟ احسن يكون معنا اثنين، لانه الموضوع ده افتكر حصل very often، وفي الاخر لما يحصل هنا انتربشن بنعيد الكيس من الاول بتاخذ زمن.
يلا يا شباب، الناس اللي ما خشت
اثنين،
كله ما
واحد
قدم.
برايمري واحد باك اب.
يلا don't worry just go in and talk. يعني ما في اي مشكله يا اخواننا. حسي الاش he did well، النجومي he did well، فنحن كلنا بنتدرب. يلا انا الاسماء قدامي ما عايز اقول اسم يا اخواننا، احسن تخشوا براكم. يعني الناس اللي ما قدمت خالص قبل كده. يلا منو حيتقدم؟
somebody معاه واحد باك اب.
لو سمحت
بعدين
في
نلقى
عرض،
الرئيس في الاول. يس
لو سمحتوا أنا بس I have one comment and one addition for the previous case.
تفضل.
Regarding comment Dr. Nujumi had did pretty good, but I noticed that he occasionally using medical jargon. I can notice that he has said Do you feel that do you have derealization or depersonalization? I think this should be avoided when talking to patient because it increases the distance between the therapist and the client or patient.
Agreed, يا خلف الله. Agreed with you.
Okay. Regarding comment, this case social phobia or social anxiety disorder. لكن عندها diagnosis specifier اللي هي يسموها performance type. البرفورمانس تايب ديفر يعني السوشيال انزيتي اوفر العاديه فلانه التريتمنت ديفرنت من الديفرنت بيتا بلوكر. بس كمان حبيت اقول ثانك يو
شكرا لك يا خلف الله. يلا يا جماعة دارين فولنتيرز. الزول النكست. وانا ناسي ساكتة على الليلة 70 زول.
يا بوس إيمان بشير.
ايمان بشير. طيب دارين لنا زول باك اب جست ان كيس. ايمان انت وين؟
في عمان.
عمان. المفروض شبكتك كويسة.
أيوة لكن في نويز يعني في إزعاج في الباك جراوند.
ما سمعنا اي ازعاج حاليا.
تمام شبكتي كويسة فل.
كويس. المفروض ما يقطع، لكن بس نشوف لو في زول داري يخش باك اب ان كيس يعني احتاجناه.
هلا تبتدي يا ياسر وان شاء الله نشوف بعد ذاك. انا بعد ذاك ثاني
انا
حاجة
بخش
للستة. I will name names طوالي تاني
انا
لانه
بخش
ما في
باك اب ذاته كان موضوع خيري لانه ما عايزين نضيع الزمن.
ما في مشكلة ان شاء الله. شكرا لك.
طيب يلا ايمان جاهزة؟
نعم.
طيب تمام جدا. اوكي كوني كيبيدي. اوكي scenario information. You are on call psychiatrist. The medical team in the emergency department has asked you for help to evaluate a 68-year-old woman who arrived by ambulance. According to reports, Mrs. Kebedi tried to drown herself in the bathtub, but her daughter intervened and called emergency service. Connie Kebedi has been saying to medical staff that she believes she's cursed, and that life is an illusion. Laboratory tests have been conducted. She has been deemed medically fit. Task. Your task is to explore patients' distorted belief and undertake a risk assessment. So this is a focused history. ده ما history كامل، ده focus history. Okay?
أوكي.
هي اللي هي psychotic depression in the elderly. Psychotic depression in the also known as depressive disorder with psychotic features is relatively rare compared to other forms of depression. Estimates often indicate that psychotic features may occur in about 14 to 19 of cases with major depressive disorder requiring hospitalization, but this percentage is significantly lower in the community sample. The prevalence in community sample is generally much lower, often cited at around 2 to 4%. The condition affects both gender and can occur at any age, although it is more common in older adults. The etiology of psychotic depression is complex and not fully understood. It is likely to be multifactorial, involving genetic, biological, and environmental factors. Neurochemical imbalances, particularly in dopamine and serotonin, have been implicated. Stressful life events, family history of mood disorders, and other underlying psychiatric conditions may also contribute. The ICD-11 outlines criteria for diagnosis of schizophrenia spectrum and other primary psychotic disorders, which category within the category, depressive disorder with psychotic symptoms is specified. To be diagnosed, the patient must exhibit depressive symptoms, low mood, and hedonia, along with delusions or hallucinations. The psychotic symptoms must be congruent with the depressive themes. The National Institute for Health and Care Excellence NICE recommend a combination of antipsychotic medication and antidepressants for the treatment of psychotic depression. Electroconvulsive therapy may be considered for severe cases. Cognitive behavioral therapy is advised for less severe forms, or as an adjunct treatment. NICE guideline emphasizes close monitoring of patients due to high-risk nature of this condition. The monthly prescribing guidelines recommend pharmacological approach that may include combination of antipsychotic and antidepressant medication. In cases that do not respond to medication, ECT is generally recommended. Long-term maintenance treatment involving medication is often advised to prevent relapse. Psychotic depression is a severe psychiatric condition that requires comprehensive treatment and management. Accurate diagnosis in the line within the ICD-11 criteria is crucial for appropriate treatment, which often involves a multifaceted approach as per NICE and Maudsley guidelines. Due to the complex nature of this condition, treatment should be individualized and closely monitored. Approach, this is the point Leaky here. Anticipate a patient who is severely depressed and harbors delusional beliefs and is therefore reluctant to engage. Display empathy, and if the patient continues to insist that life is an illusion, that she is cursed, ask, "Can you tell me what led you to believe you are cursed?" To encourage her to divulge more information. Starting off, initial introduction. Hello, I'm Dr. Hamilton, a psychiatrist from the mental health team. Would you be willing to share with me what has happened? Eliciting psychotic delusions and challenging delusions. Empathetic statements. It sounds like you have been going through a lot. How long have you felt this way? When you say life is an illusion, what does that mean to you? How did you come to believe that you are cursed? Could you explain how you can talk to me in life? If life is an illusion, is there another explanation? On a scale of 1 to 10, how certain are you that you are in a curse? Eliciting depressive symptoms. Key questions. Can you describe how have you been feeling emotionally before you started to think life is an illusion? How has your mood been recently? Have you been sleeping well? Have there been any disturbances? Have you been thinking that life is worth living anymore? Eliciting psychotic symptoms. When you're by yourself, have you heard any experiences that felt strange or unusual to you? Do you hear any voices or noises when nobody's around? Do you feel as though your thoughts are being controlled or influenced? Risk assessment. You mentioned earlier an attempt to drown yourself. Can you tell me more about what led you to do that? How did you go about doing it? Was anyone harmed? Was any property damaged? Has your appetite been affected? How about your energy level? Do you feel that you are in control of your own feelings? Do you have any current thoughts of ending your life? What plan have you thought about? What are your plans moving forward? Is there anything or anyone who might stop you from taking such an action? Key points: engage empathetically with the patient who is expected to be severely depressed and delusional. Conduct a thorough examination that touches on both depressive and psychotic symptoms. Effectively challenge the patient's delusional belief without confrontation. Perform a comprehensive risk assessment that covers harm to self, others, and property. جاهزة؟
Yes.
Okay.
There's no point to any of this. Why do you need to even talk to me?
Hello, Connie. I am Dr. Iman, a psychiatrist from mental health. Would you be willing to share with me what has happened?
Why do you care? It doesn't matter what happened. The curse follows me everywhere. My daughter dragged me here when she should have just let me go. None of this makes any difference.
I am here to help you about this awful experience. Would you be able to share with me what happened lately with you, please?
Help! No one can help me. The curse is always there. My mind is full of shadows. I don't understand what you mean by webcam. Why does that matter now? It won't change anything.
Who are following you, and what is the nature of these shadows?
You're not making any sense. No one's following me. I said the curse follows me. It's not people, it's something worse. It's everywhere in my head, in my life. Nothing chases me except this darkness.
I'm sorry to hear that. I want you to tell me more about your mood lately, please.
There is no work anymore. They let me go after my husband died. Since then, everything has fallen apart. I used to have purpose, but now I am just nothing. The curse took that from me too.
How did you come to believe that you are cursed?
I don't know what you're asking. These questions don't make sense. Why are you not listening? The curse took everything, my husband, my job, my peace. Nothing else matters now. Are you still there?
Yes, I'm there. Dr. Yassir, I feel I can't complete.
Okay, I'll take over. Please, anybody wants to take over? ولا and I can take over. So Connie, it sounds like you've been dealing with these scary thoughts about being cursed. How did you come to such conclusion?
It's not just thoughts, it's a feeling deep inside. Ever since my husband died, bad things keep happening one after another. I lost my job, people avoid me, nothing goes right. It's like something evil is stuck to me. I just know something is wrong with me.
I'm sorry to hear about the loss of your husband. So when did that happen?
It was last year. After he died, everything turned dark. The house felt empty. I lost all hope. That's when the curse really took hold. Since then, nothing has been the same.
I'm sorry about your loss. Seems to be a very huge loss for you. So tell me, you said like think, sorry?
He was my whole world, my partner, my friend. When he died, something inside me broke. Now I just feel empty, and this curse, whatever it is, won't let me rest.
When did you start feeling that the curse happened? Did it happen immediately after he passed away?
It got worse after he died, but I think it started before. Bad luck, strange things, people turning away. After he passed, it became unbearable. Every day since then, it feels like I'm sinking deeper.
Can you tell me more? You said bad luck and people turning away. What happened?
People I knew stopped calling, stopped visiting. I lost my job for no reason. Small things go wrong every day. Lost keys, broken things, arguments. It's like everything I touch falls apart. Like I'm marked and no one wants to be near me.
It sounds like you had a series of bad events happening back to back.
Yes, that's how it feels. One thing after another, never stopping. It's not normal. It has to be more than just bad luck. That's why I know it's a curse. It won't ever let me be happy again.
When you say a curse, I mean, what is the source of that curse?
I don't know. Whoa. No, don't know exactly. Maybe someone wished me harm, or maybe it's just meant for me. Sometimes I think it's because of something I did in the past or something my family did. I can't escape it. No matter what I try, it just stays with me.
And I understand recently you tried to end your life. You tried to drown yourself.
Yes, I did. I couldn't take it anymore. The pain, the darkness, the curse. I thought if I ended it, maybe there would be peace. My daughter stopped me. She shouldn't have. Now I'm just stuck again, trapped in this nightmare.
For how long have you been thinking about ending your life?
It's been in my mind for months now. The thoughts come and go, but lately they're always there. Since I lost my job, it's gotten worse. Some days it feels like there's no other way out.
Was there anything in particular that day that pushed you to act on your thoughts?
That day, everything felt heavier. I hadn't slept, hadn't eaten. My daughter was worried, but I just felt like a burden. I looked around and saw nothing but emptiness. It was like the curse was screaming at me, telling me it was time. I couldn't fight it anymore.
And just to be clear, were you hearing a voice at that time?
No, not a voice. It's more like a feeling, a pressure in my head, a heaviness. It tells me I'm cursed, that nothing will change, that I should just give up.
Okay.
But it's not someone speaking, just this deep feeling inside.
Have you had any other unusual experiences recently?
Sometimes I see shadows moving when there's nothing there. Things feel strange, like I'm not really here or the world isn't real. It's hard to explain. Everything feels off, like I'm stuck in a bad dream I can't wake up from.
Do you feel happy at this moment that you're alive?
No, I don't feel happy. I feel empty. I wish my daughter hadn't stopped me. Now I just feel trapped. There's no joy left, just this heaviness and the curse.
And if you, by any chance, get a chance again to maybe end your life, would there anything that will prevent you from doing so?
If the curse stays, I don't see why I would stop. I don't have hope for things to get better. Maybe my daughter, but even she can't protect me forever. I just want the pain to end.
What about treatment here? Do you think the treatment can help alleviate some of the symptoms you've been dealing with?
I don't believe in treatment. Nothing has worked before. The doctors just talk, give me pills, but the curse stays. Maybe it helps some people, but for me, it's too strong. I don't think anything can really help me anymore.
When you say before, have you had a previous treatment in the past?
Yes, I have. After my husband died, they gave me tablets. Sometimes I saw someone to talk to, but it didn't change much. The darkness never left. It just hides for a little while and then comes back stronger.
Do you remember by any chance the name of the tablets?
No, I don't remember. There have been so many pills over the years. Some made me tired, some did nothing. After a while, I stopped caring about the names. None of them took away the curse.
Were you taking the medications recently?
No, I stopped a while ago. They weren't helping. I didn't see the point in taking them anymore. The pain and the cost stayed, so I just gave up on them.
And for how long have you been feeling down, depressed? Have you been feeling like this in the past, or did that happen just recently after your husband passed away?
I felt low before, but after my husband died, it became much worse. Before I could manage, I had work, I had him. Now it's just emptiness. Since he left, it's been every day like a heavy cloud that won't go away.
I'm sorry to hear about that. Have you been able to enjoy things you used to enjoy in the past?
No, nothing feels good anymore. Things I used to like, cooking, church, seeing friends, they all feel pointless now. I don't have energy, and it feels like the curse ruins everything I try to do.
Was there any change in your sleep or appetite?
Yes, I barely sleep now. When I do, the dreams are dark, or I wake up feeling worse. I hardly eat either. It has no taste. I just don't care about it anymore.
Any changes in your weight recently?
Yes, I think I've lost weight. My clothes feel looser. I just don't have the appetite anymore. Eating feels pointless, like everything else.
Sorry to hear about that. Have you been feeling more anxious recently?
Yes, I feel anxious all the time. My heart races. I worry something bad is about to happen, even when I'm alone. The curse makes me feel unsafe everywhere.
Okay. And how long would that feeling last?
It doesn't really go away. Some days it's worse, some days it's just there in the background. But I can't remember the last time I felt calm or safe.
Okay. And does that anxiety prevent you from sleeping?
Yes, it keeps my mind racing at night. I can't relax. I lie awake for hours thinking about everything that's gone wrong. Makes it hard to rest at all.
Sorry to hear about that. And, just hearing about your depression, was there any time in your life when you had the opposite of these symptoms of depression? A time when you felt happier than the usual in a way that people felt like something is wrong with you?
No, I don't think so. I was never like that. There were times I was happier when my husband was alive, when I had my job, but never too happy or strange, just normal before all this darkness started.
Or a time when you were talking faster than usual and when people notice something is different or have done things that you usually would not do, being more impulsive with spending or talking faster, anything like that?
No, never. I've always been quiet. No one ever said I was talking fast or acting strange like that. I didn't spend more or do reckless things, just sadness and this heavy feeling, not the opposite.
Okay. And speaking about such depression, have you had a similar episode like this of sadness or even feeling you're cursed in the past when you were younger?
Not like this. I had sad times like everyone, but nothing this deep. I never felt cursed before, not until my husband died and I lost my job. This is the worst it's ever been.
Have you ever been hospitalized for treatment of mental illness?
No, I haven't. This is the first time I've ended up here like this. Before, it was just tablets and talking, no hospitals. I never thought it would come to this.
Have you ever tried to end your life in the past or hurt yourself?
No, not before this. I had the thoughts, but I never acted on them until now.
Okay.
This time, it just felt like there was no other choice left.
Any current health issues with you right now?
No big health problems that I know of. Just this darkness in my mind. Sometimes I get headaches or feel tired, but nothing else serious.
Any problem like diabetes, hypertension, thyroid problems?
No, I've never been told I have thyroid problems or anything like that. No diabetes or high blood pressure either. Not that I know of. Just feels like my body is tired from everything in my mind.
Okay. And by any chance, is there any mental illness in the family? Relatives with depression, schizophrenia, any mental illness?
Not that I know of. I don't remember anyone in my family being treated for mental illness. Maybe people were sad sometimes, but nothing like what I have now.
Okay. Has there been any suicide in the family?
No, no one in my family has taken their own life, at least not that I know of. This curse feels like it's just for me.
Okay. And just as a question, just to know more about you, where were you born?
I was born in Kenya. I lived there most of my life before coming here to England to stay with my daughter. It's not home though. Nothing feels like home anymore.
And for how long have you been living here with your daughter?
I've been here about 2 years now. Came after my husband passed, hoping it would help. But the sadness followed me. Nothing changed.
Okay. And as I understand, you used to work until recently. What did you do for a living?
I worked in a care home, looking after elderly people. It gave me purpose. I liked helping others. But after my husband died, I couldn't keep up. They let me go. Since then, I felt useless.
Was there any reason why they let you go?
They said I wasn't coping well. I was late, distracted, not myself. I suppose they noticed something was wrong. I just couldn't manage anymore. Everything felt too heavy.
Sorry to hear about that. And right now you said you live with your daughter. Do you have any other children?
No, just my daughter. She's the only one I have left. She tries to help, but I feel like a burden to her. She doesn't understand what it's like living with this curse.
And do you have any other means of support?
No, I don't really have anyone else. My friends from before have drifted away. Family is back in Kenya, but we don't talk much now. It's just me and my daughter here.
How do you support yourself financially?
I depend on my daughter now. She helps with everything, food, rent, bills. I have no income of my own since I lost my job. Makes me feel even more useless.
Okay, sorry to hear about that. Yep. Um, we ask this question to everybody here who come for a treatment. Do you smoke by any chance?
No, I don't smoke. Never have. Just drink tea now and then. That's all.
Is alcohol by any chance a problem for you?
No, I don't drink alcohol. Never liked it. I just keep to myself mostly.
Have you ever been experimenting with any of the street drugs? I understand, but we have to ask this question. Marijuana, cocaine, anything like that.
No, I've never used any drugs like that. Not in Kenya, not here. I wouldn't even know where to start. That was never part of my life.
And I understand, but we have to ask this question. So sorry if this question, offended you by any chance.
It's fine. I know you have to ask. Just feel strange, that's all. None of that ever mattered for me. My troubles come from somewhere else.
Yep. And by any chance, any previous problems with the law?
No, never had any trouble with the law. I always try to live quietly and do the right thing. My problems are inside, not with police or anything like that.
I understand. Thank you. All right. Do you know by any chance what date is it today?
I'm not sure. The days blur together. Maybe it's Thursday or Friday. I don't
What
really keep track anymore.
what
It
about the
all
month?
feels the same.
What about the month?
I think it's June now, but I can't be sure. Time doesn't feel real to me these days.
What about the year?
It's 2024, isn't it? Feels strange to say. Time just slips away from me lately.
And do you know which city are we in right now?
Brighton, I know that much. My daughter brought me here. This hospital, this city, none of it feels real anymore.
Okay. Can you name the days of the week? Just name them forward.
Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. I remember that much at least.
Sure. And now I'm going to ask you if you can name them backward.
Sunday, Saturday, Friday, Thursday, Wednesday, Tuesday, Monday.
Thank you very
There.
Thank you very much. Yeah. Do you think you have a mental illness?
I don't know. Maybe that's what people say. But to me, it's the curse, not an illness. I just feel broken, not sick. The pain feels too real for just a sickness.
Do you feel you need treatment?
I don't trust treatment. Pills, talking, nothing has helped before. The cause is too strong. I don't believe anything can fix what's wrong.
قطعت معانا في الزمن. انا غايته افتح للناس الكومنت. انا بس في
والله يا
الاخر
رب ما
هي
شاء
بس
الله.
يجو سيستماتيك، بس ما اكتر من كده هو. بس يعني أفتح الناس الكومنت في حاجه اتغطت ما غطيناها.
ما
والله يا
شاء
رب ما
الله يا
شاء الله،
دكتور،
حتى
ما
حتى انا
خليت
ما
على شيء.
ارتحت.
خلينا نبتدي في الأول بإيمان. إيمان عثمان وينه؟ ما هي اشتغلت شوية
Yes.
في الكيس دي. اتفضلي، انت مالك حصل شنو بالضبط؟
أنا قبل الكيس كان عندي palpitation زي دخلت في مم، anxiety
عادي.
اوكي، عادي ما
فتوترت
في مشكلة.
فبقيت ما
امم
سامعة البيشن كويس، يعني البالبيتيشن
اوكي.
بقت،
امم
فعشان كده. لكن إن شاء الله
معلش
المرة الجاية
معلش.
أقدم أحسن.
no problem, you did well، ما في مشكلة. بتحصل الانزايتي لبعض الناس في ظروف معينة وبتنتهي إن شاء الله، لكن you started well, there is no problem. اوكي، خلاص نخليكي بس تستمعي حسي عشان ما يحصل حاجة تانية. طيب ياسر، طبعا أهم الكومنتس كلها هتكون بوزيتيف يعني ياسر.
ما
ده
عايز واحد
شغله.
يقدم. عادي، انا بالنسبه لي nothing is perfect في الاخر. ساعات ما
لا
حتغطي
لا
الكيس
لا
كلها.
لا، ما هم ده شافوه موديل، يعني this is a model and I think يعني ما في اثنين ثلاثة. very very organized questions going in a row في كل most of the history mental state examination. ماشي، ده عايزينه كده يا شباب، نحن منكم عايزين منكم الحكاية دي. وما صعبة والله، أصلا ما صعبة، بس just to be calm, relax and put yourself in a training situation rather than an examination situation. It's not an exam situation. وكله ما ممكن يحصل anxiety عادي، ما في مشكلة. آه but we can overcome an anxiety. وكل ما نعالج حسي أو we expose ourselves حسي، حتى في الامتحان بعدين ما بتحصل إن شاء الله. أوكي.
هي
برضه نفتح الكومنت زي ما قال ياسر، تفضلوا.
هي براكتس وبعدين جو سيستماتيك. لما يجو سيستماتيك ما حتنسى. اما هي الفكره مش انه يعني بعدين افتر ا وايل يو دونت هاف تو جو سيستماتيك، لانه الفلو بتاعت الكيسز ذاتها بتتغير من المعلومه. انا هاد تو جو ثرو باست سايكاتريك هيستوري لما جت لي ان ذا باست. الكيوز بتغير الفلو. لكن انت عموما جو سيستماتيك ما حتضيع. جو سيستماتيك with the questions ما حتضيع. الناس.
دكتور ياسر،
ايوه.
والعيان بدأ معي بالباست، أكمل معاه وأرجع للبريزنت، والله أقول له دقيقة نرجع نبدأ في البداية، بعدين أفضل الصح شنو عشان أكون مرتبة وأورجنايز وما أنسى الحاجات.
ما تقع العيان وراكي الباس. اتس فيري امبورتنت. انت اكسبلورد بريفلي هنا. اذا irrelevant خليها معاكي، لكن يو جاست يو تيك اوفر وبعدين امشي تاني للفلو بتاعك. يعني ما سنة ما تعمل خديها. اتس relevant. جاب عليكي اتس relevant. قال لك انه in the past. I was like, you said in
مم.
the past. Have you had this experience before? Tell me more about
مم.
what happened. Was it different than this time ولا لا؟ Okay. Going again to what's happening. Are you currently going on? You move on بعدها.
مم. آه.
ايوه، ده سؤال مهم يا اخواننا. البيشنت ما اورجنايز زيك وما عنده systematic kind of answers or questions. هو يقول لنا الباست ناخد منه من الباست، there is no problem. اهم شيء بعدين انت when you present the case you present it systematically. ما هتبتدي بالباست psychiatry history، انت هتبتدي بالchief complaints والhistory presenting illness. لكن اي كلام يقوله البيشنت انت بتاخده. ودايما زي ما قلنا في اللونج كيس اكزام، انت اصلا بتكون مع البيشنت براك لوحدك، فممكن يبتدي لك باخر حاجه في الهيستوري اللي انت بتسجلها، لكن بعدين بترجع للحاجات القدام. يعني المهم شيء when you present حسب الفورمات اللي انت عارفه. ثانك يو.
طيب ندي كيف فرصة تانية لزول تاني.
يلا، وانه هياخد الكيس الجايه الناس اللي ما اخذت قبل كده يا شباب،
في زول رفع يده
لانه
ونزلها.
دي اخر كيس، دي الكيس الاخيره.
عندي بس كومنت، أنا ما قدمت قبال كده.
اتفضل قول الكومنت.
اللي هو استفسار مثلا براكتيكال بوينت بتحصل اللي هو during interview مرات البيشنت بيسأله من حاجة بيستفيض فيها. يعني مثلا أسأله من حاجة وفي ناس أصلا طبيعتهم يعني بيدوا تفاصيل يعني. فالحاجة دي طبعا بتاخد من زمن، سواء كان امتحان أو سواء كان كلينيك أو يعني من واقع خبرتكم يعني how to manage.
زي ما قال ياسر، ان احنا دائما في حاجه اسمها the art of controlling the interview. how you control and you manage the interview. ودي دائما في الاوبزيرف انترفيو مع الاكزامينرز، ما بيقول لك جيب البيشنت، جيبه و ask the patient about كده قدام الاكزامينرز. they see how you control the interview without making any mess ولا without making any troubles with the patient. You should have the art to control it, to control the time. Okay, I understand what you have said. This is important, but we'll come to it later. بدون ما تقاطعوا تقول له لا لا، الكلام ده ما بيهمنا حسي. تقول له اوكي if you get some time we'll come to this later، وتمشي في الحاجه بتاعتك، لانه دائما في الاوبزيرد انترفيو في الفاينل اكزام بالذات في اللونج كيس it is 10 minutes، وفي ال 10 minutes دي عايز منك تو تاسك. ف managing the interview controlling the interview is part of the interviewing skills اللي يجب ان يتمتع بها كل تريني. اوكي.
واضيف حاجه كمان انه هي دي ساعات it's a sign، يعني في الاخر if the patient is tangential ولا the patient is يعني somewhat يعني not disorganized with the thinking is يعني all over the place. This is part of basically a mental status examination finding. يعني انت في الاخر you elicit this، لكن بعد شوي you take a control. بدل تديه open ended questions كثيره you're gonna limit that too. لو عرفت انه الزول مثلا الليله بيتفسح بيك just limit it. هتبقى شويه more focus on very direct question. يو ري
بالظبط.
ادجست، انت حتبتدي باوبن اندد لكن ري ادجست.
absolutely. وفي بيشنت كثيرين عندهم circumstantiality، ما بيشنتس، في ناس طبيعيين عندهم circumstantiality.
اي
الزول الطبيعي بيتكلم معاك يتونس معاك عنده circumstantiality. فالart of controlling the interview is part of the interviewing skills and get trained to this art. يلا بقى لنا تلت ساعة على نهاية اليوم، نشوف الكيسة الأخيرة، منو رفع يده ومنو عايز يتقدم ليها. لانه بعد ده نحن اولموست حسي 50 من 100، 50 تريني قدموا، باقي 50 ما قدموا. 50% اوف الترينيز واسمائهم موجوده عندنا اللي قدموا كلهم اللي ما قدموا. فاحسن الزول يجي فولنتيرنج بدل ما نقول يلا يا فلان انت يلا عندنا كيس وحدي وزول يتقدم لها لو سمحتوا.
يا اخوانا والله
سمعت يا بص لو
الموضوع ده
اسامه
is a
بسمع.
practice. is a practice في الاخر، هي ما حتعلم الا to practice.
في زول يتكلم قال حاجه ما سمعناه.
ايوه ايوه، بس انا خلف الله. بس
قدمت يا
حبيت
خلف
اضيف
الله.
اي قدمت، بس انا كانت يعني عن الكيس الفات، عايز بس اضيف فيها حاجه صغيره يعني.
خلف الله بس معلش، لانه هي كل
انت
20 minutes
diagnosis
لازم نستفيد منها في الكيس، معلش
اللي
خليك
هو
كمل
الدايجنوزس
كمان.
يعني انت سايكوتيك، او يعني الدايجنوستيك مع السايكوتيك ديبريشن، او ريسنتلي بيقول الدايجنوستيك مود ديس اوردر والسايكوتيك فيتشر.
ما بتفرق كثير، ما
العلاج
بتفرق
انت
كثير.
سايكوتيك
فانت ايذر
وانت ديبريشن،
باختصار يا خلف
او اي
الله،
سي تي
I
لو ما
خلف الله
حصل استجابه.
either you follow ICD 11 or DSM 5، الاثنين acceptable.
بس كده وشكرا لك.
ايوه ايوه.
يا اخوانا عشان نكسب الزمن another volunteer. نجيب مرضى حقيقيين نشتغل معاهم. في اقتراح من فاطمة، كانت مرضى حقيقيين.
كده خلينا اقتراحات. حسي احنا حسي الاقتراحات دي عندنا ميتنج، بنعمل ميتنج. حسي ان احنا عايزين ناس تشارك. هديل المهدي، شاركتي قبل كده يا هديل؟ هديل.
أيوة أيوة يا بس شاركت.
شاركتي، شكرا لك. فاطمة حسن، شاركتي؟
نعم شاركت.
فاطمة محمد صالح، شاركتي؟ فاطمة محمد صالح. هي اونلاين، ودي المشكلة انه في ناس يكونوا اونلاين and they are not there. فاطمة محمد صالح، انت معانا ولا بس خدتها اونلاين ومشيتي في حتة؟ we know this happens. you know this ياسر، مش كده؟ you know it. انه بتدخل نفسك وتمشي في حتة بعيدة وتكون ما في. and this is not right والله. either you go away offline ولا اشترك، لكن تظاهر نفسك اونلاين وانت ما في is not good at all. this is not part of our attitude or behavior، مش كده؟
المرة اللي فاتت ده لما انا كنت استاذنت شوية عشان الصلاة دي، رجعت لقيت في كان 27 لسه منتظرين يعني، والموضوع كان قفل قبل 5 دقائق.
طيب معناها ايوه والله ما صح الكلام ده. انا اعتقد الزول يكون شجاع ويكون honest at the same time. ما عايز يحضر لاي ظروف ما يحضر، لكن ما يخد الميكروفون والبتاع قصدي ويكون في حته بعيده، ولما يجي تنتهي القصه هي يقفل الموبايل. This is not good at all. بتدي very bad impression على الشخص على كل حال.
هسه بالنسبة خليه ممكن لو ما في الليل متقدم نتكلم عن الأسبوع الجاي، لأنه شايف الناس دي الليلة ما عارف متوترة في شنو. الأسبوع الجاي تبقى كيس برزنتيشن بدل الليلة لو في زر عنده ولا لا؟
هو دائما اللاست تو ويكس هم عارفين كده. اللاست تو ويك اس بي اي، يعني الناس عندها الجدول بتاع المحاضرات. حتى ايمان الشريف لما انا قلت لها الليله كيس برزنتيشن قالت لي الليله اس بي اي. قلت لها لا يا ايمان، اللاست تو ويكس اس بي اي مما بدينا من جولاي. اللاست تو ويكس اس بي اي، لكن الفيرست تو ويكس كيس برزنتيشن، كيس بيس ديسكشن. الناس ما عارف. رأيته الحمد لله، نقول الحمد لله.
خلاص ما ناس بيه.
نمارق، اشتركتي قبل كده يا نمارق الحسن؟ اشتركت نمارق، اسمها قدامي. وينك يا
يا
نمارق؟
دكتور.
نمارق دقيقة. نمارق انت معانا؟ نمارق الحسن. ايوه
يس يا بوس،
اشتركتي قبل كده؟
اشتركت
اشتركتي
قبل
مش
كده.
كده؟
أيوة.
اوكي
أيوة
شكرا
معلش،
لك.
بس المايك بتاعي ما قدرت أفتحه طوالي.
ما في مشكلة، ما في مشكلة، ما في مشكلة. والله نحن يا اخواننا ما عايزين نلجأ لانه هبهزرد نسأل الزول انت قاعد معانا ولا ما قاعد معانا. ما بتشبهنا الحكاية دي والله، اصلا ما بتشبهنا جد والله. الاونستي وانه الزول يكون اونست وواضح، والله مهما كانت الظروف انا اكون اونست وواضح. ما عايز احضر ما بحضر بس، لكن ما خدت اني انا حاضر وانا ما في. This is not good. This is not good. سجود، اشتركتي قبل كده؟
أيوة يا
سجود
بوس. أيوة يا بوس.
قدمتي؟
لا ما حصل قدمت نو.
طيب
بس
سجود.
في مرة قبل، لا قدمت مرة بس كانت يعني ما برزنتيشن كامل، يعني كان قبل ما نبدأ.
اوكي حسي خشي كيس حتى لو الزمن ضايقنا هنا. دونت وري يعني هي سجود. اوكي خشي.
أوكي.
يلا تفضل ياسر.
يا
طيب
بوس، فاطمة كتبت في الشات تحت إنه شبكتها بتقطع، ما سمعت. معلش شبكتي بتقطع قالت فاطمة محمد صالح.
اوكي اوكي.
الكيس Nikolai Ivanov, scenario information. You are the psychiatry doctor on call. You have been tasked to assess a 42-year-old male who has been brought into the emergency service after being found on a bridge, seemingly preparing to jump. You have been informed that he was stopped by police, to whom he confessed that he was driven to end his life because he believes he is responsible for a catastrophic event. Medical personnel have completed the initial blood test and have cleared him medically, although they know he is highly agitated. Your task is to delve deeper into the patient abnormal belief and to perform a comprehensive risk assessment given the high risk situation. It's almost similar to the previous case. The only difference إنه العيان هنا ده ممكن يكون هايج. فإفري تايم لما العيان يهيج فيك يقول له يعني okay show understanding, show إنه أنت you're trying to help and just يعني ما أكتب you're trying to help here, you're not trying like I mean I'm trying to see how can you be of help. ده بالذات لما يكون I understand it sounds like you're being upset today and we're here to help you.
اوكي
انا هختصر البري ريدنج بتاعت الديلوجنال بليف دي والنايس جايد لاينز بس هخش في الكوميونيكيشن سكيلز. Building rapport, approach the patient with empathy and without judgment. Use open-ended questions to encourage the patient to share their thoughts and feelings. Validate the patient's emotion and acknowledging how real and distressing the delusions is for them. انت you don't have to agree with the delusion. هو بيتكلم معاكي مثلا انه ملح جني. This sounds like a scary experience. انت you're not agreeing انه I believe you. You don't have بالعكس ما المفروض توري انك you believe him and he's right ولا لا. This sounds like a scary experience. I'm not sure how have you been dealing with this. حاجة زي كده ده. You're showing empathy هنا ما أكتر من كده. Exploring delusional beliefs. Gently inquire about the nature of the patient delusional belief without reinforcing or challenging the delusions. Understand the onset, duration, and impact of the belief on the patient's life. Risk assessment communication. Discuss thoughts of self-harm or suicide openly, ensuring the patient feel heard and supported. Assess the immediacy of the risk by exploring plans, means, and intentions related to self-harm or suicide. Questions to ask the patient. Can you tell me what has been going through your mind recently? You mentioned feeling responsible for something significant. Can you share more about these thoughts? How have these thoughts affected your mood and daily activities? Have your thoughts about harming yourself or have you thought about harming yourself or ending your life? Do you have a plan for how you might harm yourself? Have you felt like this before or is this the first time? What support system do you have in place? Are there people you feel you can talk to? How can I best support you right now? The simulation will test ability to navigate a complex psychiatric assessment, focusing on the patient delusional belief and high risk of suicide. The approach should be empathetic and thorough, ensuring you cover all aspects of patient's mental state, risk factors, and support needs. Remember, your primary goal are to understand the patient's perspective, assess for immediate risk, and begin formulating a plan for their care and support. جاهزة؟
اوكي بس I have question.
تفضل.
هو بالسيناريو انه يعني they found him in like يعني police هو اللي مسكه صح يعني.
I think he was driving recklessly.
sorry.
If I'm not mistaken, he was driving recklessly. افتكر هنا ده في
اوكي بس انا يعني حابة اربط بين السيناريو وبين انه احنا بنسأل عن الريسك اسسمنت والسويسايد.
هذه الكيس ذاتها قالوا انه هو وينه راح. اوكي. He was stabbed by, like I mean, you have been informed that he was stopped by police, to whom he confessed he was driven to end his life because he was driven to end his life because he believes responsible for catastrophic event. He was preparing to jump.
اوكي thank you.
اوكي.
اوكي
جاهزة؟
اوكي good
Okay.
start.
I don't know why I'm here. It's not like talking will change anything. Shall we just end this all?
Okay, we are here to help you. So, is it the first time or you have previous trial?
This is the first time anything like this has happened. I never thought things would get this bad. Before, if I felt off, I just kept it to myself and pushed through. But now it's like I can't control anything anymore.
Okay. And are you taking any medication now?
No, I'm not taking anything. I've never been prescribed anything before. I never thought I'd need help like this.
Did you feel sad previously?
I fell down before, yes, but it was never like this. I used to have bad days, maybe some trouble sleeping when things got stressful, but I could still function. This is different. It's like the sadness never goes away now.
Okay. Did you meet any doctor? Did you try to find any help?
No, I didn't. I thought I could handle it on my own. I didn't want to burden anyone or seem weak. I just kept hoping it would pass. But it kept getting worse. I didn't know where to turn.
Okay, then what happened now? What led you to try this trial?
It all became too much. I couldn't sleep, couldn't eat, couldn't think about anything except what happened. When I saw the news about the volcano in Turkey, I knew it was my fault. The guilt kept building up. I started hearing things, voices, like the news anchor talking about me, blaming me. I couldn't take it anymore. I thought if I went to the bridge, maybe I could make it stop.
Okay, this thought it's what is how many who is telling you, or how many people they are telling you? One or more?
It's usually just one voice, the news anchor from the TV. Sometimes it feels like he's right there, talking about the disaster and saying, it's all because of me. It doesn't stop, even when I try to block it out. It's always the same, blaming me, repeating the details.
Okay, did he give you any order?
No, he doesn't give me orders exactly. He just keeps saying it's my fault, that everyone knows what I did. He talks about the disaster, how people are suffering because of me. It's more like constant accusations, not instructions.
Okay. Then did you try to stop this sound? If there is any action you do to stop this sound?
I've tried everything I can think of, covering my ears, turning up music, even shouting at him to stop. Nothing works. Sometimes I just sit in silence and hope it will go away, but it never does. It just keeps coming back no matter what I do.
Okay, this sound come from outside or you feel from inside?
It feels like it's coming from outside, like someone is actually speaking near me. But when I look, there's no one there. I know it doesn't make sense, but it sounds so real. It's hard to tell what's real anymore.
Mm. Okay. So, do you believe that you are sick, or you need help?
I I don't know. Part of me thinks something is really wrong, but another part, I just can't shake the feeling that I deserve this, that I caused all of it. Maybe I do need help, but I'm not sure it will make a difference.
Okay, if we prescribe for you any medication, you will take it?
I guess so. I don't know if it will help, but I don't want to feel like this anymore. If you think it might make things better, I'll try. I'm scared nothing will change.
Okay, fine. No, we are here to help you. We can change.
All right. I just hope something can make this stop. I don't want to feel like this anymore.
Okay, sure.
Thank you. I just want some peace, even for a little while.
Okay, so I understand you.
I appreciate that. It's been a long time since I felt understood.
Thank you. We are here to help. Everything can be okay.
I want to believe that, but it's hard right now. Still, thank you for saying it. It means something to hear that.
Yes, thank
All right.
Okay,
If you need to ask me anything else, I'll try to answer.
regarding your work, your life, are you working now?
No, I haven't been able to work for a while. I just can't concentrate or get anything done. My mind keeps going back to the same thoughts. I feel useless, honestly. I haven't told my boss what's really going on.
Um, you stop your work for how long?
It's been about a month since I stopped working. At first, I tried to log in from home, but I just couldn't focus. Eventually, I just gave up. I haven't touched any projects since then.
And this sound started before 1 month also.
Yes, it started about a month ago too. Around the same time I saw the news about the volcano. That's when everything got much worse. The voice just appeared, and it's been there ever since. Are you still there? Are you still there?
Yes, sorry. In your family, is there is anyone he has same your problem?
If you mean if anyone in my family had problems like this. My mother was always sad when I was growing up. She never talked about it, but I think she struggled with depression. No one ever mentioned anything about hearing voices or things like that, though. We didn't really talk about these things in my family.
Okay. And what about your
Sorry, could you repeat that? I didn't catch the last part. What did you want to ask about?
um
Are you still there?
okay, what about your personality previously?
I used to be pretty quiet, more comfortable with computers than with people. I liked routines, kept things organized, tried to do my best at work. I wasn't outgoing, but I had a few close friends and some hobbies. I think I was reliable, maybe a bit too hard on myself sometimes, but nothing like this. Now, I barely recognize myself.
Okay. And what about the education?
I went to university for computer science, studied hard, graduated with honors. I always took my studies seriously. It was stressful at
Okay.
times, but I managed. I was proud of what I achieved back then.
Yeah, nice. Okay. And are you married?
No, I'm not married. I had a few serious relationships, but nothing that lasted. My last relationship ended a couple of years ago. Since then, I've mostly been on my own.
Okay. There is one question I need to ask it. Are you taking any drugs or drink alcohol?
No, I don't use any drugs. I drink alcohol sometimes, but not much. Just a beer now and then, nothing heavy. Lately, I haven't even wanted that.
Okay. Mm.
All right, if there's anything else you need to know, just ask.
ماشي wait.
Okay, I'll wait.
Sorry, المايك ما انتبهت. Um,
It's all right. If you need to ask something about the hospital or about me, you can go ahead.
Dr. Yasser,
Keep going.
I don't know. يعني regarding the task, I don't know what can we ask more.
Risk assessment.
If you need to know about risk, well, I've thought a lot about ending my life. I went to the bridge because I couldn't see any other way to escape the guilt and these thoughts. I still feel hopeless, but being here, at least someone's listening. I can't promise I'm safe, but I want this pain to stop.
Okay, and do you think to make it? No.
I'm not sure what you mean. Do you mean if I still think about ending my life? The thoughts are still there. Sometimes they feel very strong. But right now, I'm just tired. I don't know what will happen next.
Okay,
All right, if you need to ask anything else, I'm here.
okay, what is the thing can let you stop thinking about or let you to be away from trial like this?
Honestly, I don't know. Sometimes when the thoughts get too much, I just try to distract myself, maybe listen to music or walk outside. But nothing really makes it stop for long. Today, I think it was the police and the people who saw me on the bridge that stopped me. If they hadn't shown up, I don't know what would have happened.
There is another thing can stop you?
All right, I understand. If you want to change the topic or if there's something specific you need to know, just let me know.
I think there is no thing more. Or okay, do you think do you think now um, to repeat do you have the same idea again?
The thoughts are still there, yes. I can't say they're gone. Sometimes they come back even stronger. Right now, being here, maybe it's a bit less, but I can't promise it won't happen again. I just feel trapped by everything in my head.
Okay. طيب دكتور ياسر I think إنه هو still he has the idea but يعني هو ما عنده مشكلة إنه to receive treatment or management.
You have to ask exactly what يعني explore the idea of safety.
Sorry?
You have to explore how safe he is. يعني he was.
هو
Hmm?
هو بيقول إنه يعني
Okay.
I understand.
الأفكار
If you're
ممكن
asking about how
تعني
safe I am, honestly, I don't feel very safe with myself right now. The thoughts come and go. Sometimes they're not so strong, but other times they're overwhelming. Like at the bridge, I can't guarantee I won't try again if things stay the same. But I am willing to try treatment if it could help.
You go with the rest of the history.
Okay, I ask about family history, pre-morbid history, and social history, educational, and past medical history,
I
I
grew up
asked,
in
he
St.
said
Petersburg, Russia.
he's
My family was middle class, focused on education. I was always more interested in computers and books than socializing. I went to a good university for computer science, graduated with honors, then moved to Canada in my late 20s for better job opportunities. Work was my main focus. Software development, I don't really have family here, just a few acquaintances. My last close relationship ended a couple years ago. Since then, I've kept to myself, mostly working or staying home.
okay. You told me that this is the first time, or you have no any history of depression in the past, right? Or any.
That's right. I've never had anything like this before. Maybe sometimes I felt down or anxious, especially when things were stressful, but nothing close to what's happening now. I never saw a doctor for it or took any medication before.
Okay.
All right. If
Did
you
you
need
try
anything else, just let
before?
me know.
Sorry, did you try before this time to end your life?
No, this was the first time I actually went that far. I've thought about it before, especially over the past few weeks, but I never tried to do anything until today. Today was different. It just felt like I couldn't cope anymore.
Okay.
All right. If you have more questions, I'm here.
Thank you.
You're welcome. Thank you for listening.
He's a very nice patient.
انا حكفي لانه انا مضطر يعني اكون في الباك جراوند من الكمبيوتر. هخش معاكم بالتليفون. انا المفروض بس اخذ العيال بالحته. دكتور عبد الغني انت موجود معنا؟
ايوه يا ياسر موجود. انا افتكر
انا
خلاص لو
هخش في if you can take over انا هخش في الباك جراوند بس
نو
ماشي ودي
بروبلم.
العيال.
يا خلاص والله I think we can terminate it here ياسر لانه it's after midnight you know. ف I think we can terminate it. We just discuss سجود next time إن شاء الله what he has done. شكرا يا سجود. يعني it's not a very difficult experience يعني it's a good experience. شكرا لك وشكرا للجميع وافتكر we can stop it now. We can end it here. شكرا ياسر. شكرا
ان شاء
للجميع.
الله.
حضرت معنا دكتورة مهجة ودكتور عبد الله tonight وعبد الله عبد الرحمن. وانا I think النكست ويك برضه هيكون SBE وعندنا زي ما قلت 50 حسي تريني يشتركوا باقي 50 وهنختارهم واحد واحد بعد كده. Thank you very much.
طيب يلا في معي مع السلامه.
مع السلامة.
كويس.
شكرا.